Good evening. Thank you very much for joining us here on Urban Debate on Mirror Now. I am Heena Gambhir. Tonight, let's focus on India's frontline workers who are out on the streets once again. I'm talking about 15,000 plus nurses from state-run hospitals in the state of Maharashtra who are on an indefinite strike. It's day 4 today, and this has now started impacting the healthcare services. Planned surgeries are being postponed. Now, why are they protesting? They are against government's plan to outsource nursing services. They want the government to reverse its order of transferring nurses every 6 years. They are demanding equal pay for equal work as compared to the central government nurses. Now, these viewers are India's COVID warriors, very, very important in any hospital, the backbone of a hospital in the country. And in the absence of nurses, services at some of the biggest hospitals have been hit across the state of Maharashtra. For example, JJ Hospital in Mumbai, where thousands of people go for treatment. Elective surgeries have been postponed. Critically ill patients will have to be transferred to other hospitals if the situation does not improve. Now, this comes at a time when hospitalizations due to COVID have increased by 231% in Mumbai in the month of May as compared to April. You heard me right. There has been an increase in hospitalization because of COVID infection in Mumbai in the month of May specifically. After 2 months of decline, ICUs in government hospitals are beginning to see an uptick in admissions. Here's what the nurses have told us.
हमारे नर्सों का इस पर आज तक शब्दों पर भरोसा नहीं रहा है, इसलिए हम लोगों ने डिमांड किया है कि सबसे पहले हम लोगों को मीटिंग मिनट्स दिए जाए। जब तक मीटिंग मिनट्स नहीं आते हैं तब तक हम ये आंदोलन नहीं रोकेंगे और हम लोगों को जो भी लिखा जाएगा वो पढ़ना है। उसमें अगर कुछ दिक्कत है तो हम फिर से शासन के साथ बात करेंगे और जब हम सेटिस्फाइड है जो मिला है लिख के तभी हम आंदोलन ये रोकने के लिए घोषित कर देंगे।
It is the very pathetic situation that the nurses are on strike and it's the 9th day, but nobody is there to listen them. And the outsourcing is the topmost demand of every nursing union and federation. Even in central government, Ministry of Health and Family Welfare has already issued the clear direction not to recruit the nurses through outsourcing. But still the state governments are forcing and making the policies in each state, and they are trying to fill the vacancy through the outsourcing.
We are here demanding for ourselves and protesting for our rights. So basically students are there, but patients are at risk, so they should think about this and they should think about our demands, which are purely for the beneficial of patient and for the beneficials of ourselves also.
To whom you are going to get on the contract basis, are not going to pay the salary to them? They'll be given the salary, no? So that same salary, why can't you give to the permanent staff?
Now, the hospital's viewers were prepared for 2 days of strike, which was the initial plan of Nurses Association. But now that the strike is still going on, elective surgeries have been put on hold. But they can't be on hold forever. Hospitals are exploring the option of transferring critical cases to other hospitals. Here's what the Dean of JJ Hospital has to say.
As a dean and as a head of an institute, I'm very much optimistic that the strike gets called off. But in case it doesn't, we have to be prepared. We should always have a plan B going. So our plan B today is, fortunately, Mumbai is blessed with 5 medical colleges, which are public hospitals, so to say. And the staff nurses there are not on strike. Also, Grant Medical College has 4 hospitals, out of which none of the nurses in Kama and All Bliss Hospital are on strike. So we would have a plan today of whether we call for the nurses with the permission of the government from these institutes, from the municipal medical colleges to come and help out here, or we could shift out our patients or refer them to these hospitals. Kama Hospital especially deals with mother and children, so they could move there. So that will be the plan. We'll decide by this evening if the status quo continues, because we can't defer surgeries forever. Otherwise, an elective surgery would become an emergency surgery tomorrow.
What happens now? Well, today there was a crucial meeting between Nurses Association and the state government. While the government has agreed to most of the demands of these nurses are saying that they will call off their strike only after they receive a written assurance. Mirror Now spoke exclusively to the Medical Education Minister of Maharashtra. Here's what he said.
As government and as Medical Education Department, we are in agreement with the issues raised by them. So we've given them a schedule of 45 days within which most of the demands will be met. And I think by evening today or in a couple of days, I hope and expect that they call off the strike and resume work. Outsourcing is only done as a temporary arrangement. And, in times of emergency, when, in COVID, we had to do outsourcing. So at such times, we do have to outsource, but that is not our permanent policy. Outsourcing of nurses will happen through the government recruitment rules, that is an examination, a written examination, a merit list, interviews and appointment.
After the meeting with Amit Deshmukh, now the delegation has come over here and you can see they have joined the protest and they are raising their demand. It was a fruitful meeting when it comes to the demands, and also the minister has assured them that their demands will be met out in 45 days. But they are firm on their stand that until unless they get the written assurance minute of the meeting, they will not call off their strike. And you can see these nurses from all across the state government hospital are sitting here and are continuously protesting, and they are demanding that outsourcing should be stopped. And there are many other demands which have been discussed.
So this is a report that my colleague Abhishek sent to us earlier from the site where these nurses are protesting. So how legitimate are these demands? If the government has agreed to the demands, why not give an assurance so that patients do not suffer? Is something that we are going to be discussing on Urban Debate on Mirror Now this evening. Joining us on the broadcast this evening are my guest, Professor Aarati Pugaonkar, who is BJP spokesperson. We have with us Dr. Raju Wagmare, Congress spokesperson and General Secretary Maharashtra, joining us on the broadcast. We have Krishna Hedge, leader Shiv Sena, also on the broadcast this evening. Sumitra Tote, who is General Secretary Maharashtra State Nurses Association, will be joining us in just a bit. And also with us is going to be Dr. J.A. Jayalal, former National President IMA. Appreciate all of you for joining us here on Urban Debate on Mirror Now this evening. Mr. Krishna Hedge, let me begin the discussion with you. If indeed the government has agreed to the demands of these nurses, why not give a written assurance to them so that they can end their strike and the work begins?
Let me first tell you that the nurses and the government, headed by our Honorable Chief Minister Shri Uddhav Sahib Thackeray ji and our Medical Education Minister Shri Amit Deshmukh ji, had a very fruitful meeting today. And when they met Mr. Amit Deshmukh ji, you have already spelled out their demands. One was that there should not be any contractual nurses employed. So the government has informed them that these nurses on contract were employed only during COVID times, and as there is no need to employ them or retain them now, they will not be there in the near future. The second thing is that the nurses wanted pay as per the central government, which is not possible because the central government and the state government have different pay scales. But the Honorable Minister has informed them that we will try to match the allowance and the pay given by the central government. So that demand has also been, taken care of. The third thing is they wanted a COVID allowance, and I think that discussion also has been fruitful. And the fourth thing is that they did not want to be transferred for 6 years. So all their demands have been met. Now the minutes have been written, and now the minutes being drafted are going to be sent to the nurses on email. after which the nurses are going to circulate in their respective groups and come out with a draft, and after which they will call off the strike. So I'm very hopeful that by tomorrow or day after, the strike will be called off. The government has matched all their demands, and if not matched their demands, have agreed to all their demands. And we are very constructive and fruitful. We have realized that these nurses have done very humanitarian service during the COVID, saved a lot of lives, and we had to bring in nurses on contract because at that time the cases were rising and the deaths were plenty. And to save lives and to save patients and to give proper treatment in hospital, contract nurses were employed. Now, since the cases have come down, we do not need the contractual nurses. However, since these nurses have also given their life and soul during this COVID, we appreciate and we are totally together with their demands, and therefore a very fruitful discussion with the Honorable Minister has taken place, and we are agreeable to their demands. So I don't think there's any controversy on that.
Okay. There is no controversy at all, says the spokesperson of the Shiv Sena, Professor Aarati. But the question is, why come to this kind of a situation that, frontline workers, these COVID warriors have to be out on the streets? Can't we take care of the people who protected all of us during COVID pandemic? Because it's not the first time that nurses have been out on the streets protesting like this. Last year also, 23rd of June 2021, more than 6,000 nurses across state-run hospitals were on a 2-day strike that time too.
Yes, actually, I wanted to bring the same question that why state is taking so long. I mean, on 23rd May, the symbolic protest started. And when symbolic protest started, where was the minister? Where was the other officials? When they were meeting nurses, what they were really doing? So why it is after 9 days, minister is coming ahead? Why this meeting is happening after 9 days? Why MVA is basically putting patients at risk? Right now, due to this strike, as you have also focused on something that due to the strike of nurses, all elective surgeries, planned surgeries have been cancelled, or overall surgeries which happened, 1/3 of those surgeries are actually happening. I heard the dean of JJ Hospital also, she has a plan B. I know that doctors, nurses, they are the backbone of our healthcare system. And if this is the situation, they have to come on road for their demands. It's really shameful for Maharashtra state government. I feel so. Secondly, I want to ask why, instead of asking nurses to call off the strike since this week, why officials were not really, arranging for the discussions, why their demands were not being heard, why they were not attempted to be, being made. So these were the questions. Secondly, in these 9 days, we have seen that every organization of nurses, resident doctors, and others have come in supported. So when we are talking about their demands, I feel that their demands are reasonable and fair. And I don't think that, again, we talked about outsourcing and recruitment. When I was reading about this in news or whatever information what I've got, I realized that, or I understand, I learned that they are not asking to create new vacancies. They are only asking to fill in the existing vacancies of nurses. The issue why government is taking too long to find a solution in this case. We have seen that during corona pandemic time.
Okay, why did the government take so much of time to, come to this sort of a conclusion? That's what BJP is asking. BJP says demands are fair. Dr. Raju Wagmare, I know Krishna Hedge also wants to respond, but before that, Dr. Raju Wagmare, how will you like to respond to the points that have been raised by Professor Aarati? It started as a symbolic protest on 23rd of May. Why was it not solved immediately? Now the concern is about rise in COVID hospitalizations too.
First of all, I wanted to say that the demands of nurses, they have raised the demands around 11 to 12 demands they have raised. Almost all the demands are accepted by the state government. They agreed for all those demands, and we are carrying forward about it that we already gave assurance to the nurses and we sanctioned their demand. So I think that once we are in a medical field, I am a doctor, So once we are in a medical field and when assurance is given, we have to give the priority of the patients and we have to give priority of the people. And I know that the nurses are doing a fabulous job. They have done a fantastic job. They put their life ahead during the corona, and hats off to them that they have done that. See, the government machinery, no matter which government is on the power, the governments has certain restrictions, certain paperwork, certain hierarchy, and that's how the government moves. And those those are the things which give little bit time, but it's not mean that the government is totally unaware of it. The government is specialized and the government is specially thinking and they understand their pain, and we that is the reason we agreed on all the demands that what they were raising. So now I feel that, and I wanted to urge
Okay.
through mirror now to I wanted to urge through mirror now to all my nurses sisters that please, now the assurance has been given by the government. So I hope that they should call off their strike as early as possible and they should come to the service for the people, because government is with them and government is agreed on almost all the demands. Only that one or two demands are there. That is their transfer on the non-nursing post. That is an administrative post. Those
Right.
transfer thing has been taking a decision, because for that they have certain approvals and all that has been done. Once that will be done, everything has been approved, and we are with nurses. Government, Maharashtra government is with nurses. Our chief
Okay.
minister, Mr. Uddhav
Maharashtra
Thackeray,
government
and
says that
Amit
it is with
Deshmukh.
the nurses, and the Congress spokesperson is urging the nurses to end the strike that has been going on for quite some time now. Let's go across to Sumitra Tote, also General Secretary Maharashtra State Nurses Association, who's been listening patiently to each one of you. सुमित्रा जी, हमसे बात करने के लिए बहुत शुक्रिया. अभी हमें बताया जा रहा है शिव सेना और कांग्रेस पार्टी के स्पोक्सपर्सन के द्वारा कि आप लोगों की जो भी डिमांड्स थी वो सरकार ने मान ली है. अब आप लोग क्या करने वाले हैं, हमें बताइए. क्या आपकी जो ये स्ट्राइक चल रही है, प्रोटेस्ट जो चल रहा है, अब आप इसे खत्म कर देंगे? क्या आप संतुष्ट हैं सरकार के जवाब से?
नमस्कार. हमारी मांगों को लेकर आज ऑनरेबल एजुकेशन मिनिस्टर के साथ हमारा डिस्कशन हो चुका है, मीटिंग हो चुकी है, किंतु इसमें आउटसोर्सिंग की जो अगेंस्ट जो आंदोलन चल रहा था उसके बारे में कुछ फर्म कुछ डिसीजन नहीं हो पाया है. फिर भी हम लोगों ने मीटिंग में एक कहा है कि जब तक हम लोगों को मीटिंग के मिनट्स नहीं मिलते हैं तब तक हम आंदोलन के बारे में कुछ डिसीजन नहीं लेंगे. अब तक हम वेट कर रहे हैं कि हम लोगों को मीटिंग के मिनट्स मिल जाए. इसलिए अभी तक हमने आंदोलन पीछे लेने की कोई कमिटमेंट नहीं की है, और जब तक मीटिंग मिनट्स नहीं मिलते हैं इन मांगों को लेकर आंदोलन चालू है.
जी सुमित्रा जी, हमें ये बताया जा रहा है कि आपकी जितनी भी मांगे थी सबको मान लिया गया है. क्या आपको ऐसा आश्वासन मिला है?
हम लोगों को ऐसा आश्वासन मिला है, किंतु हम लोगों को जो मीटिंग मिनट्स एक्सपेक्टेड है जिसमें रिटर्न एक्सप्लेनेशन होना है, मीटिंग के बारे में डिटेल्स होने हैं, वो अब तक हम लोगों को मिले नहीं है. और हम लोगों ने ऑनरेबल मिनिस्टर साहब को यही बताया है कि जब तक हम लोगों को मीटिंग के मिनट्स नहीं मिलते हैं वो हम उसका पढ़ेंगे. वो अगर सही में उसमें ये लिखा गया है तो हम आंदोलन पीछे लेने के बारे में सोचेंगे.
जी, Krishna Hedge wants to respond. Dr. Raju Wagmare also wants to come in. Krishna Hedge, to you first.
Yeah, I would just like to inform, like Sumitra ji said, that all the demands have been met, and now they are only waiting for the minutes. And as soon as they get the minutes, they will circulate it among them, their own colleagues, and then call off the strike as per their satisfaction. Secondly, what the BJP spokesperson said, that why did the minister come in the last minute? And here also सुमित्रा जी आप बता सकते हैं कि मंत्री जी के पहले इतने सारे ब्यूरोक्रेट्स ने आपके साथ डिस्कशन किया, इतने दिन किए, 4-5 दिन से ब्यूरोक्रेट्स भी डिस्कशन आपके साथ कर रहे हैं और उसके बाद हमारे ऑनरेबल जो मिनिस्टर है उन्होंने भी आपके साथ डिस्कशन किया और उसके बाद हल दिखलाया. शायद द बीजेपी स्पोक्सपर्सन डज नॉट नो अबाउट दिस. आई वांट टू एनलाइटन हर इन दिस मैटर.
Bureaucrats have always
Okay, Dr. Raju
connected to
Wagmare, then
Sumitra
Professor
ji,
Aarati.
and they have asked them to call off the strike.
No, they have had a
So
discussion.
my question
Has
was,
to be
when I
communicated
said
into
that
the
why
Honorable
it took
Minister
9
sitting together.
days
You
to
said
come in
that
the
why
minister.
it took
And Hena, I want to point out
This
one
is-
more thing. I heard Amit Deshmukh ji also when you showed their comment. He said that about outsourcing, he was also not clear. And the same point Sumitra ji have also mentioned. And this is the reason. See, it has been history of MBA that any minister, any officials, when they say something, they do not keep their word. The very next day, we have seen in many cases the words have been changed, and this is the reason I think that they are asking for a written minute, so that they will have
Yes,
something
yes,
in written.
Dr. Raju
that
Wagmare.
government is agreeing on this. See, this is a question of trust.
Can I say something now? See,
Yes,
you have
yes,
to
yes.
understand, the BJP spokesperson has to understand the outsource. It's required for any government when there is a pandemic or when there is an emergency, and we have to fill the vacancy immediately. Because to give and go with a regular process, it takes the advertisement, it takes the interview, it takes the process that you have to follow. And when the pandemic or any emergency occurs, and that time you require nurses, that is the time the government, any government, goes for the outsourcing. So outsourcing is not doing only when Mahavikas Agadi is there, and outsourcing is not doing anywhere, is doing in central, is doing in every state. It's happened when it is required. We are saying that we will
Okay.
not go for it. Whenever it is required, we will use the process. Now, second thing I wanted
Quick
to
rebuttal,
mention,
Professor Aarti, then I'll go
Whenever
across to
it is
Dr. Jayalal.
required,
He's been waiting
Hena,
patiently for quite some time.
I really want to intervene because right now Wagmare ji and Hegde ji both have said they, made me clearly understand that what is outsourcing. But I want to just point out one thing which I already have said, that these nurses are demanding to fill in existing vacancies. Okay. Now, if as you mentioned that outsourcing takes place in emergency, I completely agree. But then we have seen a 2 years long period of COVID pandemic, and we have seen that how there was a situation in what situation basically nurses were recruited through outsourcing. So after that pandemic, as you mentioned, in
Yes.
month of May, again there is rise of patients in hospitalization, right? So in that case, there is a need of patients, and healthcare
Yes.
is one
I
sector
think-
in Maharashtra state and in India. This is one of the
I think,
sector where we
National
require staff
spokesperson
in
maybe,
good numbers.
I'm
We
sorry to
cannot
say that
wait
he
for
doesn't
emergency
understand the
Okay,
recruitments in this
let me
sector.
now go across to one second. All of you, please calm down. Please calm down. Let me now go across to Dr. J.A. Jayalal to understand firstly, how legitimate are the demands and the outsourcing issue that has been raised by the nurses here, which of course the government has assured them that they will be looking into this matter.
Yeah, thank you. We fully agree on the principle of outsourcing during emergency. But what we are not able to understand is the hire and fire policy successive governments are following. They have hired quite a lot of doctors, quite a lot of nurses during the time of emergency. But once the emergency is little over, they think that they can easily fire them out. And that is not an appropriate thing. When nobody was interested to come forward to support the people who are suffering with corona, so much of nurses, so much of doctors has come forward, irrespective of their health concern, irrespective of their problem with their life, and they should be respected, and they should not be allowed to come to the streets to fight for their demands.
Exactly.
If the government is sensitive enough, they should have definitely given care for them. And even now, if you see this 15,000, if the staff, the outsourcing, it is not sufficient. The number of staff nurses now available, nurses available in our healthcare industry is much, much less than what we need there. The number of staff posting which is giving is definitely much lower. We need more nurses if you want to definitely improve the healthcare standard. So I appeal to the government, do not just go in eye-washing statements, do not give that, make it a minute, give us an order, and definitely they will listen to you and they will follow you.
Can I answer to
Can we
this?
come into this?
Okay, Dr. Raju Wagmare wants to come in. Yes. Yes,
See
then
what
Mr. Krishna
happened.
Hedge.
Yeah, what happened in a pandemic? Just I'll give you the example. There is so many COVID centers. The extra COVID center has been opened by the government, and we recruited, outsourced the nurses and doctors over there. But once that pandemic is over or that kind of facility is over, to accommodate all this staff into the government facility, it is not possible because the government facility to get all the staffs and give them a job, those facilities not available because that is the extra facility we open. So it will take time to accommodate them as and when the government facility that we are increasing for the health department. So that is the condition. It's happened because like we opened maybe 10 COVID centers, we took another maybe 1,000 or 2,000 nurses, and then to take those 2,000 nurses on a regular hospital, it is not going to happen. It will take time to
सुमित्रा
open
जी,
some
क्या
more
आप सहमत
facilities.
हैं डॉक्टर राजू वाघमारे जो अभी बता रहे हैं? क्या इस बात को नर्सेज मानने के लिए तैयार हैं?
Pardon, please.
सुमित्रा जी, कैन यू हियर मी? सुमित्रा जी, मैं आपसे पूछ रही हूँ, अभी डॉक्टर राजू वाघमारे जो बता रहे हैं आउटसोर्सिंग को लेकर, क्या नर्सेस इस बात से सहमत हैं? क्या आप सब लोगों का कहना है इस पूरे मामले को लेकर?
पैंडेमिक में बहुत सारे नर्सेस को आउटसोर्सिंग से लिया गया और पैंडेमिक के बाद उनको निकाल दिया गया। आउटसोर्सिंग अभी गवर्नमेंट हमें बताया जा रहा है कि केंद्र शासन की पॉलिसी है, किंतु जो प्योरली सेंट्रल गवर्नमेंट के हॉस्पिटल से वहाँ पर आउटसोर्सिंग नर्सेस का आउटसोर्सिंग नहीं हो पाया है। और जिस तरीके से आउटसोर्सिंग अभी महाराष्ट्र में करने की कोशिश हो जा रही है, जिसमें ठेकेदार नर्सेस को नियुक्त करेंगे, इसमें इन प्रोसेस में नर्सेस बहुत ज़्यादा हराश हो सकते हैं और हो चुके हैं। This is not a way to treat recruit nurses for in the service of patients. और इस चीज़ में ना ही बेरोजगार नर्सेस है उनकी हानि नहीं है, और जो जिस पर काम वो करने वाले हैं वो जीवित रुग्ण है, उसके लिए भी ये गंभीरपूर्ण बात है। और उनका जो उनकी जो सैलरी दी जाने वाली है वो भी बहुत कम है, वो सेटिस्फाइड नहीं होते हैं। और ये आउटसोर्सिंग नर्सेस को आउटसोर्सिंग से रिक्रूट करना ये किसी भी हाल में ये सही रिक्रूटमेंट नहीं है। एज अर्लियर गवर्नमेंट ने हम सबकी यही डिमांड है और रहेगी कि एज अर्लियर परमानेंट रिक्रूटमेंट्स के लिए कुछ विदाउट स्पेंडिंग मोर टाइम ये रिक्रूटमेंट हो जानी चाहिए,
है ना?
Professor Aarati wants to come in, then Mr. Hedge.
Yes. Now, Hena, whatever Sumitra ji have
Professor
just
Aarati
said, she have just, pointed out on two things where she talked about the harassment of nurses done when they are recruited through a contractor, number one. Secondly, now Wagmare ji and Hegde ji are saying that the number of nurses, I'm not very clear. I'm not understanding what they're trying to say. So I just wanted to know that how many nurses are there and how many are actually required. Now, this is a point which the other Dr. Jayalal ji has pointed out, that do we have enough nurses which we are actually required? So the answer is no. And that is why the demand of nurses, which is, coming from nurses, that the regular vacancies are to be filled. So I think for that, what process they are saying, they should have started immediately after pandemic, because we have faced that, we have undergone that pandemic situation, and the need was clearly felt from that time that the regular vacancies are
Krishna Hedge
required
wants
to
to
be
respond
filled
now.
in
Go
as
ahead.
soon as possible.
Yeah, I don't think the BJP spokesperson has understood what is happening, because she's first speaking about employing the nurses. Second, she's speaking about not taking contractual labor. Third, she's speaking about getting nurses from outside and filling vacancies. So there's a little confusion in the BJP camp. First of all, the BJP should appreciate that in a pandemic, the government led by Uddhav Sahib Thackeray ji has put up these camps, enhanced the hospitals, given the treatments, enhanced medical facilities, saved lakhs of lives, got the medicines, procured medicines from outside, and given an infrastructure within a space of a month or 2 months to handle a very huge pandemic which the entire world has suffered. She is not understanding the gravity of the situation. I cannot believe it. She's talking about nurses vacancy being filled. We are talking about COVID here, madam, and we are talking about the enormous quantity of work done by the government. Now, whatever the nurses have done, we are totally with the nurses.
All
They
this
are
is
given their
fine,
lives
Mr.
and
Krishna
souls,
Hedge.
and
All
we
this
are,
is
we
fine.
are
My question is that if there was a meeting today in which your government has agreed to accept all the demands of these nurses that they've been asking for, then why not expedite this process of
no, so the
handing
draft
over
is the
minutes of
I'm
meeting to them so
Exactly.
that
so
they
the
end the
draft is being
strike and get
prepared.
back to work?
The draft is being prepared. The draft will reach them. The nurses will look at the draft. They will revise whatever they want to do, circulate among themselves, and if there is any amendment to the draft, they will do the amendment. Eventually, it is an
So
economic
you're
scale. It
saying
is
by
a social
tomorrow the
scale.
draft will be given to them?
Yeah, I think that the draft should be given to them by either by today or by tomorrow, and they can go through it. And I again appeal to them to call off their strike, because we need them, and we are with them, and we have not said no to any of their demands.
Okay. And before I go back to Dr. Jayalal, let me go across to Sumitra ji once again. Okay, Dr. Raju Wagmare also wants to come in very quickly, Dr. Wagmare.
See, as we are speaking right now, the government, Honorable Minister, Mr. Amit Deshmukh and his team and the government officers are already preparing in a draft. They are in a position that they will prepare the draft and deliver to them ASAP. And all the demands, I told you, almost all the demands has been made. We agreed on that. And everything is going to be, once the minister is going to agree, he said yes, and everybody's, all the officers also said, and they are preparing it. We are in a position to give them today or tomorrow, and just we are requesting them to please, rather than going through this, what do you call that, administrative process, rather than it's a government demand and government agreed on that, please go back to the duty, call up the strike, because patients need you. And we need you, and we are with you. The government is with nurses, all our chief minister, our health minister, everybody is with them, and we understand their sacrifice and their duty. So we are just thanking them, and plus we are requesting them to please call off the strike and come back to the work.
ओके सुमित्रा जी, अभी हमें यही बताया जा रहा है कि आज रात या फिर कल तक आप लोगों को मिनट्स ऑफ मीटिंग जो है वो मिल जाएंगे। जो आपकी बातचीत हुई है सरकार के साथ में, क्या सहमति हो चुकी है सारे मामलों को लेकर, या अभी भी आपको लगता है आउटसोर्सिंग का जो सबसे बड़ा मुद्दा है उसको लेके शायद कहीं ना कहीं कुछ चीजें नहीं मानी गई हैं अभी भी?
We are very thankful to Honorable Minister Amit Deshmukh sir, जिनकी उपस्थिति में आज की मीटिंग हो चुकी है, जिस पर सारी मांगों पर चर्चा तो हो चुकी है, किंतु हमारे पिछले 3 स्ट्राइक ऐसे हैं जिसमें हम लोगों ने आश्वासन पे पीछे स्ट्राइक लिया है। इसमें डिस्कशन तो हो चुका है, आउटसोर्सिंग पर भी बात हो चुकी है, किंतु हम वहीं पर हम यही कह के आए हैं कि हम लोगों को मिनट्स देखना है, रिवाइज करना है। अगर उसमें कुछ हम लोगों को एक्सपेक्टेड नहीं है तो हम बात करेंगे प्रशासन से या गवर्नमेंट से, और ये मीटिंग मिनट्स मिलने के बाद ही हम स्ट्राइक के बारे में डिसीजन ले सकते हैं।
Dr. Jayalal, that point is very, very important, and I was mentioning this earlier also. It's not the first time nurses have come out on the streets protesting. Last time in June 2021, last year as well, more than 6,000 nurses across state-run hospitals were protesting. They were on a 2-day strike against poor wages and, huge vacancies in hospitals and many other issues. The point is that as Sumitra ji was mentioning just now, that in the past also, verbal assurances were given, but it did not translate into real thing on the ground. I want to understand from you what can be done so that we do not have this kind of a situation again. Why have we not learned any lessons from COVID pandemic? I mean, the doctors, the nurses, they helped the entire country during COVID pandemic. How can the governments forget that? Why can't we treat them well? Why can't we
never
give them
forget
what they
anybody.
deserve?
We never forget to doctors, we never forget to
now it has been
nurses,
become
Dr.
government,
J.A. Jayalal.
only
supporting
those who are crying getting the demand. But
Dr.
that is the
J.A.
unfortunate
Jayalal.
situation. It is unfortunate situation happening in our country.
They have to
that-
come out on the streets.
Yeah, the baby
And then
crying
you
is
agree
okay
to
the
their
street.
demands. When there was a symbolic
Administrators are
protest, you did not do anything.
Administrators are not understanding and proactively doing the thing. At least we are thankful to the government now understanding the issues of the nurses and accepting the demands, and that is well done. But in the future, at least in the policy, please do not think hire and fire policy. Do not go for outsourcing. Understand there is so much demand. It was not for the COVID alone. Even our hospital, our maternity hospitals, our PSC needs more staff nurses. Why not the government come out in a proactive measures and appoint the doctors, appoint the nurses in a need. Today, it is the most important thing is the health of the country. The health of the country cannot be achieved without the health of the professionals. If you want to help the health of the country, the health of the professionals has to be maintained. And mostly, nurses becomes the very important tools, and their demand has to be approached in a very positive way. Do not make us to come to the street and fight for our rights. We are believing in the government. We are not interested in the politics. Which government is ruling is not important. But we know that people who are sitting in the government should listen to the genuine demands, genuine voices, genuine concerns of the concerned people and do proactively. Because I am so happy to know that he himself is from a medical fraternity. He will understand how much nurses is needed, how much paramedical people are needed. Definitely, if there is a will, there is a way to solve this issue. Please be proactive. We are all ready to work with the government to make sure our health of the country is maintained in this country.
Well, absolutely. And with this, I'd like to thank all my guests. Thank you very much for joining us on Urban Debate on Mirror Now this evening. We really hope there is some solution as soon as the minutes of meeting are given to the nurses who've been protesting for some days now. Thank you very much, all of you, for joining us here on Urban Debate on Mirror Now. Heading in